want to thank you for your bio. I am always just so blown away when I meet somebody. Actually, I met Chulani's husband at the expo, and he was telling me about her. But then I get a little bio, and I'm so blown away by the expertise that we have coming to our meetings. So I'm going to read this out because I don't want to miss anything. So Chulani has been practicing nursing for 12 years in Sri Lanka, and she's a board-certified registered nurse since graduating the Bachelor's program in 2000. She completed a certificate in accident and disaster management in 2001 and worked as a trauma care nurse in emergency and orthopedics. She has an extensive background in emergency and surgical nursing. Chulani received the Best Emergency Care Nurse Award for her exceptional patient care in 2011. Congratulations. Chulani migrated to Canada in 2012 and volunteered for the first 2 years at the Credit Valley Hospital in Mississauga. She resumed her nursing practice in 2014 as an LPN, a licensed practical nurse in Canada. She completed the basic and advanced foot care courses in 2015, the VON Canada, and started her career as a foot care nurse. Currently, she is practicing advanced foot care for diabetes patients at Mosaic Primary Care Network. Chulani's expertise in lower leg assessment adheres to the diabetes foot care pathway and advocates patients to enhance health and well-being with an emphasis on foot care, prevention and/or diabetes disease progression. Even though we're using the word diabetes because that's in her job description, it's all neuropathy. It doesn't change for any of us. It's all the same when it comes to the care. Chulani is an active member of the College of Licensed Practical Nurses in Alberta, a certified diabetes educator, a Canadian diabetes educator certification board, and certified registered central service technician. So again, I'm just thrilled to have you here very much. So please welcome Chulani.
Okay. Thank you so much, Sylvia, for the brief information. And good afternoon, everyone. You hear me properly? Okay. Yeah. So in this presentation, I will talk to you about basic foot care or routine practices to maintain healthy feet. Okay. So it is not necessary to have neuropathy or diabetes to practice this healthy routine. Of course, everybody needs healthy feet to enjoy their life. For example, if you have lots of foot pain, how you go for hiking or cycling or simply walking, it will affect your day-to-day activities. So that's why we need to think about our feet as more important. So however, when we think about foot problems, neuropathy and diabetes come under high risk categories. So I will talk about it little bit and then come back to basic foot care. Okay? Yeah. So diabetes. Diabetes can contribute to narrowing of arteries and decrease circulation to your feet. We call it microvascular complication of diabetes. Simply, it is poor blood flow to your feet. And next thing is neuropathy. And what is neuropathy? Perfect. Yes. Yeah, you all know. It's damage or dysfunction of one or more nerves in the body. So, yes, nerves. Yeah. So, it could be due to diabetes or some other reasons as well. So, it doesn't matter whatever the reason. So, when you have neuropathy in your feet, how do you feel? I know. It's not a nice feeling. You feel burning, tingling, and lastly, it's you simply don't feel your feet. That's the most serious thing, and then we call it LOPS, losing the protective sensation of your feet. So what will happen when you lose the protective sensation of your feet, or simply if you don't feel your feet, what will happen? What can happen? Yes, true. And you will have hard time balancing, and then is there, yes, that's the, yeah, more serious part of it. And then if you walk over any sharp thing, you may not feel it but end up having skin cut. And the, and then you will continue walking. You may continue walking or whatever you were doing, not knowing that you have a skin cut because you don't feel the pain. It can be up to days until you see it. So that's the serious part. This weight bearing can increase healing time for any open skin. And with poor blood flow, tissues of the feet get less oxygen and less nutrients, which will also increase the healing time. And over the time, if you don't take precautions, open skin is high risk for any infection. So you will easily end up having a wound. That's how a little incident create a big story. Okay. So I have taken some statistics just to show you. It's not to scare you, so you will have an idea how serious it is. Okay. So according to Diabetes Canada 2018 guidelines, people with diabetes are 20 times more likely to be hospitalized for non-traumatic limb amputation. Yes, non-traumatic limb amputation. So no accidents, no any other traumatic injuries, but it's coming from the ulcers. So foot ulceration is the most serious case. And according to, are you okay with that? Can you hear it properly? Yeah. So according to International Diabetes Federation, amputation occurs every 20 seconds somewhere in the world. Every 20 seconds, one amputation. So can you believe that? Yeah. So however, the good news is 85% of these are preventable. 85% are preventable. So what can we do? How to prevent? What can we do to prevent this problem? Of course, that's the thing. Take care of your feet. Yeah. Yes, yes, perfect. Yes, I will talk about it later too. Yeah, you need to take care of your blood sugar too and take care of your feet. This overall, it's come all together. Yeah. So, how you going to take care of your feet? There it comes basic foot care. And then this prevention, as we talked before, this prevention start from you. It is your responsibility to look after your feet, not your doctor or nurse, because this is day-to-day process. It's daily process. It's a daily routine. Okay. So we'll see what is this daily routine step by step. Daily foot check. So create a daily routine to check your feet. And what are the things you're going to look for in your feet everyday basis? What are the things you're going to check? Yes, perfect. Any cuts or any cracks? And then, sorry? Yes, scratches. And then blisters. Yes. Yes, toenail conditions like ingrown toenails, fungal nails, and what else? Red, so like erythemas or reddened skin areas, red spots. And I will add up swellings and especially changes in the shape of your feet. Any change in the shape of your feet. Yes, swelling. Perfect. Yeah, thank you. Good answers. And you can take a seat. Um, and how you going to check your feet? You can simply put your foot up on your knee while you sitting down. But if you have hard time bending over or balance problem, use a mirror to check your feet. Put a mirror against the wall and stand on it, behind it, and then you can see. And if you have vision problem, use a magnifying glass to check your feet. And more options. Ask your family member to check your feet every day for you. That's even more easier. And next thing is skin care. Very basic. Wash your feet with soap and water. Use mild soap, and the water temperature, I would say lukewarm water. So when you have neuropathy, how are you going to check the water temperature of your bath water? How are you going to check? Sorry? Oh, yes. And yeah, anybody else? Yes, your elbow. The preferred method is use a thermometer. If not, use your elbow. Don't check the water temperature with your feet. When you have neuropathy, you may not feel hot or cold properly with your feet. So use a thermometer or use your elbow. Sorry? Oh my god. If it is too hot, that's not so good. Okay. Okay. So, and then once after you wash your feet, make sure you dry your feet very well. Okay, so I will take my hand as my foot. This is my toenails, and then toenails is toes. So put a towel in between your toes or face cloth in between your toes. Make sure you dry in between your toes. The reason I am telling you like this is to prevent fungal infection. Fungal infection, it smells so bad, and then it's too itchy. So of course any moisture left, any microorganism will grow nicely on wet surfaces. So that's why we need to dry in between the toes very well. Pat dry. Do not rub too roughly. Pat dry it. And again, if you have hard time bending over or balance issue, drop your towel on the floor, stand on it, and let it dry for a while. Yes, you can do that, and then use a hair dryer to dry your feet. That's even more easier. Yeah, good step.
Can we
Yeah.
go back to washing them? I know a lot of seniors like to soak their feet with like Epsom salts and stuff.
Mm-hmm.
Is that recommended?
As a routine practice, it is not necessary to soak your feet. According to Diabetes Canada guidelines and other to like whatever I learned at the school, soaking increase dryness, and it is, yes, it increase dryness, and it is high risk for infection as well. So yes, yeah.
Why is it a higher risk for infection?
It can cause like you using a basin and you're not too sure about the other steps you're going to take with that. So if there is any open skin, you are exposing the skin for the infection for a long time when you soak. If you really want to soak, you can soak less than 7 minutes, so it won't go so dry. But as a routine practice, you don't really necessary to soak your feet unless you have asked to do so by a healthcare professional. Like some foot doctors will ask you to soak your feet if they do ingrown toenails. That's as a part of treatment process, but not as regular routine, you don't need to do that. Because it increase dryness, increase callus and cracks, and then infection. Yeah. If you really like, I know it gives you so much comfort when you soak your feet, you feel so good, especially with burning sensation, with neuropathy. You can do it less than 7 minutes. Once a month is enough.
Okay. Just a reminder to everybody, if you could, when you have a question, ask for Tom to bring you the mic so that it makes it onto the camera. Otherwise, it's sort of lost in space.
Okay, yeah.
Like
Okay.
me.
So, once after you wash your feet, make sure you dry your feet very well and then apply moisturizer. Of course, Calgary weather is dry, plus some kind of health conditions like diabetes will increase your skin more dry than other people. So, make sure you apply moisturizer on daily basis. So again, when you, sorry? I- Yeah. When you apply moisturizer again, imagine this is your feet, toes and toenails. Do not apply moisturizer in between your toes or in your nails. You need lotion on top, bottom and on your heels. Do not apply in between or in your nails. That is to prevent fungal infection. Because this is a closed surface, if you apply lotion here, moisture will stay there for longer hours and then that can create fungal infection again. Okay? And then the next step is nail care. So trim your nails straight across. If you find rough edges, use a nail file or emery board to make it smooth. Make it round and smooth. And do not trim your nails too short. Nail is there for protection, so if you trim it too short, it can create fungal toenails, ingrown toenails. So how do you know that you are trimming your nails too short? I will tell you a tip. So imagine this is my toenail. So run your thumb along the end of the toenail. Run your thumb along the end of the toenail. So if you feel more nail than the skin, that means you can still cut it little bit more. And if you feel more skin than the nail, that means you already trim it too short. So if you feel nail and the skin evenly, that means that is the appropriate length. Okay? And then, as I told you before, keep your nails dry always. Make sure you dry it properly after you wash it and do not apply lotion. So that do not apply lotion on your nails. Yeah, that is to prevent fungal infection. And then for trimming your nails, try to use pair of scissors or nail nippers. Do not use nail clippers. Nail clippers starting from CLI. Do not use nail clippers. Yeah, the small little thing. Yeah, so because it takes a bigger bite at a time, bigger piece of nail at a time, that is high risk to cut your skin. So when you trim nails, you need to cut little by little, little piece at a time. So it's better to use pair of scissors or nail nippers to trim your nails. Yes, the little thing start from C. Okay, so the next step on regular foot care is regular foot check with health care provider. So health care provider means your family doctor, your foot care nurse, offloading shoe specialist, your foot doctor or foot specialist, chronic disease management nurse, or certified diabetes educator. Any of them. I would say the duration will depend on your feet. Sometimes they will check your feet every 3 months, sometimes every 6 months, at least once a year you need to check your feet with your healthcare provider, any one of them. At least once a year. Yeah. Okay. So I will talk little bit about shoes and socks as well. So when you think about having healthy feet, you need to think about socks and shoes as well, because it is very important too. Socks. So yeah, go ahead.
Okay, so like, oops. So I got this major big problem. It's like I got really big feet. Like, and I'm like, I don't know, I guess I'm a big person. But I have trouble, look at these things, do they dig into my skin?
Mm-hmm.
I can't find a pair of socks to, like, if they stay up, they dig into my skin. If they, the only way the ones that, then the ones that don't dig into my skin fall down all the time. So, you know what I mean?
Yes, I understand. But I can see that because it's pulling down. So
No, this isn't pulling down.
yeah, you put
These
it.
are good.
Yeah,
but
but
they're digging in.
it's cut off the circulation then.
Just a little.
Yeah. So the recommendation is not to wear tight socks,
I know. So
elastics or knee highs that will cut off circulation to your feet. So good option is to use diabetes socks.
I can't find any that stay up.
They won't stay that much too tight because they are like loose to your feet. It's no seams on it, so they won't stay that much high. But if you try to put it up using elastic or something, make it too tight, that's not so good.
Yeah.
And then one thing you can do is bend it one fold after, so it is not too tight then, but it still stay up. Okay, so that's what I do with my patient. If it is too tight and cutting off the circulation and patient still want to keep it up, just fold one fold down, so it will still stay up and then not cut off the circulation. Okay, and then yeah, we'll go forward. When you buying socks, the recommendation is to wear cotton or wool socks made with merino wool or cool max that provide very good padding, absorb moisture, and keep your feet dry. So it will keep your feet cool during the summertime and then warm during the winter time. So it provide very good protection. Even this thick socks which provide very good padding is a good option for you as well, because it will not fall down that much easily. Okay, and then when you buy socks, when you have neuropathy, what is the best color for you? Yes, what color? Yes, perfect. Yeah, it's white color. So he knows very well. Yeah, so white color or light colors, because you don't feel your feet much. So if you walk over any sharp thing, if there is any open skin, any drainage or bleeding from an open skin, you will easily notice it with white color or light colored socks. I would say white is the preferred color. Okay, and then lastly, change your socks every day. Of course, I think you do that. Okay, so yeah. Mm-hmm.
Repeat the answer because I never hear the answer.
Okay, sorry about that. Thank you for reminding me. Yeah, I will. I will do that.
As a diabetic, I was always told to never walk in sock feet or bare feet. And I have a pair of indoor shoes that I wear constantly, occasionally slippers. A couple of times recently, I happened to take my slipper off and I injured my foot. It was just for a few moments, and so it just goes to show that it doesn't take much. especially when you have neuropathy and you start to lose your balance, which is what happened to me. So wearing footwear is probably really key to make sure. And it's hard in the summertime. It's not fun to wear sneakers all the time in the summer, but
Yeah.
it's really important.
Yeah. Um, I will talk about it later in detail. Yes, you need to, especially when you have diabetes or neuropathy, you need to wear shoes all the times. And it is not safe to walk with socks because they are very slippery. It can be slippery walking with socks. So, yeah, can you hear me okay? You got it? Yeah. Okay. So, shoes. Um, you may not believe most of the foot problems, foot pain, and foot damage is due to ill-fitting shoes. So that is why it is very important to buy a good pair of shoes from a reputed company. It is worth to spend little bit more money and not having foot problems. So, okay, so assume that you're going to buy shoes for yourself tomorrow. And what time you planning to go? What is the best time to buy shoes? Sorry? Perfect, yes. Try to go in the late afternoon because your feet slightly swells throughout the day. It is said about 5 to 8% swelling. So try to go in the late afternoon. And if you have orthotics, bring them with you. At the store, put them on and do a test run. Take some time, at least 15 minutes you need to walk around and then find out whether your new pair is properly fitting to you. So it should be properly fit with the, like I will show here, with the length and the depth and the width. So there shouldn't be reddened areas after the test run. And what else you need to check for a good pair of shoes? What else you need to look? Yes, true. That's true. Yes, toe box size. I will talk about it. Yes. Yeah, you know those things. Arch, yes, arch support, whether it is matching to you. Yes, perfect. Yeah, you need to look for the heels. Check for the shoes with low heels, less than 5 centimeter. And check for the shoes with bigger toe box. I would say try to go for rounded toe box, which will allow more space for your toes. And do not choose pointed shoes. It will make rubbing with your toes. So the recommendation is to have at least half-inch space from your longest toe to the edge of the shoe. At least half-inch space. So I would say it's okay to buy 1 inch bigger than your actual size. So then you will find it little loose to your feet. But buy shoes with velcro or lace. So then you can fix it properly. So this is all to allow more space inside the shoe for your toes and your foot. Okay, so do not buy tight shoes or pointed shoes. Yes?
When I saw you,
Mhm.
you noticed that I had a callus on my small toe,
Mhm.
and you told me that my shoes were too narrow
Mhm.
and that I should get wide
Mhm.
shoes.
Yeah.
So that's a sign then
Yeah.
that your shoes are too narrow.
Yeah. So like imagine this is my foot again. So if you wear a very tight shoe, so it's squeezing your toes from both sides, and you can have callus here on your small toe and callus in your big toe. We call it tailor bunions and bunions. So sometimes cones come up. Sorry. Tailor bunions. Yes, tailor bunions. Perfect. So Yes, yeah. It's because of rubbing from the shoe. So that can cause blisters, callus, corns, and even wounds. So the recommendation is to buy bigger toe box and enough space in your shoes. And a good pair of shoes must have firm heel, like in the for your support for your heel, and then uppers made with breathable material. Firm heel, FIRM, firm heel, yes. And then uppers made with breathable material like leather. And do not buy plastic shoes. They are not recommended. Okay? And sandals. Sandals can create pressure on the toes and in between the toes, so it is very easy to create blisters. So especially when you have neuropathy or diabetes, try to wear closed toe shoes all the times with socks, even in the summer. That is for your safety. And as you told before, never go barefoot, even inside the house. Walking barefoot can increase callus, cracks, and sometimes plantar fasciitis or heel pulse, so many problems. So especially when you have neuropathy, as I told you before, if there is any sharp thing on the floor, could be if you have little kids around, sharp toys on the floor. If you walk over any sharp thing, you may not notice it. So buy a pair of comfortable shoes for indoors as well. Okay, so and then rip, yeah. Mm-hmm. Mm-hmm. Go ahead. Yeah, try a comfortable pair of shoes for indoors as well, especially when you have neuropathy, because otherwise it can increase dry skin, callus, and cracks, and high risk to have cut injuries, especially when you have neuropathy. You don't feel it. Okay, you got it? High risk to have cut injuries, like if you walk over any sharp thing, you may not feel it, even inside the house. So that's why if you have good supportive comfortable shoes for indoors, that is that provide you safe, keep your feet safe even inside the house, not only outside. Got it? Yeah. Okay. And replace your shoes on regular basis. A good pair of shoes should not have loose seams, holes, or any foreign objects. So make sure you replace them when it come to the time. You can feel it. Okay. And with all of these, um, make sure you check inside the shoe before every time you put them on. Before every time you put them on, because could be a pebble, could be a nail inside the shoe. So then, yes, of course, they can hide it inside the shoes. So, yeah.
Could be a tarantula or a poisonous spider.
Oh, yeah. Sure, it can happen too. It's more serious. Yeah. Okay. So we'll go to next step. So, what else we can do to have healthy feet, to maintain healthy feet? What will you do when it come up with foot problems? Medical. Yes, get an early medical advice to see your doctor. Okay, we'll talk about it. Thank you. That's the first thing. And then here, do not treat your own foot problems. As she said, see your foot caners, foot doctor, or your family doctor. That means if you do not treat your own callus, corns, or ingrown toenails, and do not use over-the-counter medication to treat warts or even corns, it can create open skin and it is high risk for infection. So see your foot care nurse, see your foot doctor or your family doctor. Get the medical advice. It's the thick skin pointed in your certain place. So skin become really rough and thick, and we call it callus. That is the normal process of the body. Skin create more and more skin for the protection over the bony prominence or rough areas like rubbing places. But in a cone, it accumulate in a certain kind of place and create a thick skin on one spot. That is a cone. Got it? Yeah. Okay, that's good. That's good. Yeah, so callus, we will talk about it later. And then our next thing is avoid extreme hot or cold. So as I told you before, check your bath temperature using your elbow or use a thermometer. And do not use heating pads or hot water bottles on your feet. Especially when you have neuropathy, you may not feel heat properly, so it is high risk for burns. And during the winter time, of course, stay warm, double your socks, and if you exposed to extreme cold weather, make sure you check your feet right away. Okay. The next thing is exercise. Exercise regularly. Exercise to your comfort level. I won't say like do this hard and fast exercise. Exercise to your comfort level. I mean, if you have lots of knee pain, try to do non-weight bearing exercise, aqua exercise. And I know you have back pains, lots of aches and pains, but at least half an hour walking every day, half an hour for a day. You can take breaks after every 10 minutes. So all together it should be half an hour for a day. And yeah, go ahead.
What if you do like swimming exercises?
Still
Deep wa-
exercise. It's fine.
Yeah, but your feet get soaked in water for an hour, not no
Yeah,
7
yeah,
minutes.
yeah. That we cannot prevent. You can wear water shoes. That is the recommendation, especially when you go for swimming. Try to wear water shoes because it is high. Swimming pools are high risk for fungal infection. So always wear water shoes. And then after you finish your swimming, make sure you wash your feet with soap and water and dry it properly, and then apply moisturizer before you put on your socks and your regular shoes. So then even though you are in the swimming pool for 1 hour, still you apply moisturizer right after you drying your feet. So if you go for swimming, first thing, make sure you wash your feet with soap and water right after swimming. Dry it very well, dry in between the toes, and then apply moisturizer and then put on your regular socks and shoes.
Does the moisturizer have to have any special ingredients in it, like lanolin or something?
Yeah, if you have normal skin, it's okay to have any moisturizer like, Gold Bond, Eucerin, Aveeno, it's okay. But if you have cracked skin, really dry skin, you need to use a lotion with urea, urimol or urea. You can check in the ingredients how much percentage of urea in this cream. Yeah. Urea, urea or urimol, same thing. urea, urea.
Urimol.
Urimol, uremol, ol.
I heard they took that off the market though.
You can check like creams like Attract's cream. They have 10% urea. Attract, ATRAC, or yeah. Yeah. Yeah, 10% would be enough. The percentage of um, not necessarily. You 10% urea is enough, and even in eucerin, it has 10% urea. So that is if you have cracked skin to heal the cracks. Even the flexitol balm, that is also good for cracked skin. Yeah. Okay. Um, I heard about it, but I'm not too sure. What we learn at the school is urea, flexitol. Those two, or flexitol. You don't have to use both, either urea or flexitol. Yeah. Okay. So yeah, we go back to exercise. And if you find exercising is too boring, you can join with a partner or join to a walking group. Like at Mosaic Primary Care where I work, we have active adults program. So it's wonderful exercise program. So join to a walking group in your area, like primary care network in your area, or you can simply do mall walking. That is also interesting. You may not get tired with mall walking. So find something best matched to you, best suits you. It will increase your overall well-being and increase circulation to your feet. So when we talk about circulation, try not to sit for longer hours. Interrupt sitting time by getting up every 20 to 30 minutes. And do not cross your legs. How do you? Yeah. Yeah. Try to interrupt sitting time every 20 to 30 minutes. Yeah, and do not cross your legs as well. And if you are sitting, okay, if you are sitting, not having break, yeah, try to move your ankles around and wiggle your toes. Do some activity. It will increase circulation to your feet. And if you are sitting or watching TV, chatting with someone, try to put your feet up. Use a stool or recliner to elevate your feet. I would say elevate your feet whenever you can, whenever possible. That's for your healthy feet. Okay? And the next thing,
Sorry. I've noticed for myself and my dad, our feet, when we sit for any length of time, like within 5 minutes, they'll start to turn purple. That's a sign of poor circulation, yeah?
Yeah, we call it dependent rubor because blood supply to one foot or to other foot, it comes purple. So that's why when you are sitting for long hours, move your ankles around, wiggle your toes, do some activities and try to interrupt sitting time. Yeah, and if you are sitting, try to put your feet up. That also helps.
Okay. Even if you're like at a desk, putting them up just like that is enough?
That helps, yeah.
Just,
Yeah.
okay.
Yeah. And control your blood sugar. That's our next step. Yes, we talk about exercise, so control your blood sugar. Yeah, as we talked before, diabetes can increase decrease blood flow to your feet. It's contribute to narrowing of arteries, so it decrease blood flow to your feet. So we need to control our blood sugar by taking blood sugar medications right, and then watch your diet, and of course exercise again. Okay, so the next step is quit smoking. Quit smoking is not that easy. I know that, but smoking contribute to narrowing of arteries that cause peripheral vascular disease, and then neuropathy as well. Of course, losing the protective sensation of your feet. So narrowing of arteries or decreased blood flow to your feet, and then losing the protective sensation of your feet is the main two things we discussed in the beginning that can create a wound on your feet. So smoking, even though it's not easy, we, we need to quit smoking. Yeah, so if you find it so hard, join to a smoke cessation program. Yeah, there are so many, like at Mosaic Primary Care Network where I work, we have wonderful smoke cessation program. And I know most of the primary care networks and Alberta Health Services also, they have smoke cessation programs. And they are free too. So let them help you. It's hard, but you can do it. Yeah, that's for your own benefit, your good health.
I just wanted to ask how you get in to see a foot care nurse. Do you need a referral or do you self-refer?
You can ask from your family doctor to refer you. So it depends. If your family doctor is belongs to like to me from Mosaic Primary Care Foot Care Program, your family doctor need to be a member of a primary care network. So then your doctor can make the referral. Otherwise, if you're going to go get it done outside, you can go, yeah, self-referral. And sometimes you have to pay for it. And if you are a senior like over 65, depending on your income, government will provide $22 reimbursement once a month for your foot care. Yeah. Yeah, we talk about yeah, pretty much everything, but I will talk little bit about places where you going to get your feet done, pedicure places. So how do you find the right place for you? What are the things? Yeah, of course, when you go for your foot care, what are the things you need to look for? Mm-hmm. Yeah. Uh-huh. Yeah. Perfect. Uh-huh. Yeah, true. Yeah. Yeah, that's what I'm going to tell you now. So, uh, yeah, most important thing is look for the tools and equipments. Are those tools are clean and sterilized after each use? How do you know? So, I will tell you a tip. If it is sterilized, those sterile packages should be opened in front of you. You can simply ask for that. And if they use basins, sometimes they soak your feet, I know. Make sure those basins are disinfected after each use. And especially when you have neuropathy or diabetes, I would recommend go for medical foot care. Foot care provided by a foot care nurse or foot doctor or foot specialist, like a health care provider. Yeah, as you said. Yes, I would say that is the preferred method. And when you go for foot care, let them know if you have any allergies. To like during the foot care procedure, we use some chemicals. We don't use harsh chemicals on you, but I have seen some people who are allergic to alcohol wipes as well. So alcohol wipes, yeah. So please let them know that you have any allergies and any special medical conditions like neuropathy or diabetes. So they will take necessary precautions on you. And do not shave your legs 24 hours prior to your foot care appointment. Yeah, I know you don't have to, but yeah, especially ladies. Yeah, so that is yeah, that is high risk for infection. It can create open skin, and if they soak your feet, that is very high risk for infection. So please do not yeah, shave your legs 24 hours prior to your foot care appointment. And then again, I want to let you know about your foot care team. That is very important. Like, you can talk about your feet with any one of these people. and let them help you. It's a big team. That is your family doctor and your foot doctor, your foot care nurse, offloading shoe specialist, and physiotherapist, and a chronic disease management nurse, or certified diabetes educator. You can talk to any of them about your feet. And if you have any special conditions, maybe vascular surgeons, plastic surgeons, or orthopedic surgeons may also involve on your foot care. So it is a big team to look after your feet. So let them help you. But again, it is your responsibility to practice a healthy routine on your feet, because it's not your nurse or doctor can do it. It's a daily process. It's day by day process. Yeah.
What's your name, Tom?
Say hi to Mom.
Thanks, Tom. Okay, I struggle with the daily thing. I know ideally daily, but wouldn't 2 or 3 times a week be better than nothing?
Yeah, I would say something is better than nothing, but I encourage you to do it on daily basis. Like, what if you cut? Yeah, go ahead.
How many minutes per day would you say that we need to spend?
You have 24 hours, so
Okay, so half an hour would be sufficient?
even less than that.
5
You need
minutes?
5 minutes, 10 minutes, that's more
I
than
think
enough.
10 minutes, probably.
Yeah, 10 minutes is enough.
All you have to do is wash them. Right?
Wash-
That's all you got to do is wash
Yeah,
'em.
yeah, we discuss about the healthy routine. Wash
And
your feet.
Dry them with a blow dryer.
Yes, and then
Put
apply
lotion on,
moisturizer.
put socks on, and you're done.
Yeah, and you check before you start doing everything. Check your feet for any blisters, red skin, changes in the shape, and start from washing then, as she said. Yeah. So that's the daily routine. So as I told you before, so this prevention start from you. So you need to practice. I encourage you to do it daily. Yeah, but as you said, something is better than nothing. Okay, so I have taken a video. Just it's kind of summarizing everything. So let's see the video. I hope it will work. I don't know, something wrong with me. No, I just want to open the link. We already opened it before. Yeah, Wi-Fi is there. Can you have? And then we'll go here. Open the link. Oh yeah.
Watch
Yeah,
diabetes
it's working.
videos at clearlyhealth.com.
As
Okay.
a person with diabetes, it is important for you to care for your
Thank
feet
you.
properly every day. If you have nerve damage, known as neuropathy, you may not feel pain if you injure your feet. Because of this, an infection can develop without warning. Decreased blood circulation slows healing. This can result in foot ulcers, which can eventually lead to amputation of the feet or legs. Prevent foot injuries by wearing shoes that fit well and have good support. Don't walk barefoot. Check your shoes before putting them on for small pebbles, worn areas, or rough spots. Avoid sandals, pointed toes, high heels, and plastic shoes. Always wear socks in your shoes. Socks are better if they do not have seams or mended areas. It is important to check your feet every evening for cuts, sores, red spots, swelling, or infected toenails. If you have any of these problems and they do not heal within 24 hours, it is important to contact your healthcare provider. If you have trouble seeing the bottom of your feet, try using a mirror. Before bathing or showering, test the water to make sure it is not too hot by using a thermometer or your elbow. If you use a thermometer, between 90 and 95 degrees Fahrenheit or between 32 and 35 degrees Celsius is safe. Water that is too hot can damage the skin. Do not soak your feet, as they can become dry and cracked, causing infection. Be sure to dry your feet well, using a patting rather than a rubbing motion. Be careful to dry between your toes and use talcum powder or cornstarch to keep the skin between your toes dry. Apply lotion to the top and bottom of your feet to keep them soft. Do not apply lotion between the toes, as this can cause the area to become too moist. Thick or hardened skin on the toes and bottom of the feet, called corns or calluses, can appear from skin rubbing against bony areas of the foot. If you have corns or calluses, it is important to talk with your doctor about how to remove them. Do not use corn plasters, corn and callus removers, or blades, as these may lead to infections. Trim your toenails straight across once a week. Smooth sharp edges with an emery board or nail file. Contact your doctor if they become thick or yellowed, or begin to curve and grow into the skin. Avoid using heating pads, hot water bottles, or campfires to warm your feet, and carefully check your feet during cold temperatures for frostbite. Keeping your blood glucose levels in your target range through healthy eating and daily exercise can prevent or decrease nerve damage caused by diabetes. Daily foot care, comfortable shoes, and having your healthcare provider examine your feet at least once a year can help minimize serious long-term damage caused by diabetic neuropathy.
Okay.
For our full library of healthcare videos, go to clearlyhealth.com.
So that's all from there. So
What if you have hammer toes?
sorry, just 1 minute, please.
Okay.
I think I went all the way back. Yeah, what was your question?
What if you have hammer toes?
Yeah, hammer toes is like, yeah, you get it with neuropathy because I will explain. Your toes, imagine this is my foot. So your toes supposed to be like this on the ground. So like this. But with some nerve changes, it comes like this,
Yep.
like change the shape. So then you touch the ground with the tip of your toe.
Yep.
Not supposed to be like that. So when you touch the ground with the tip of your toes, it can create callus and then corns on the tip of your toes. That can create sometimes bleeding. We call it hemorrhagic callus and wounds as well. So the option is go for orthotics, which will do some offloading. It will adjust the shape of your feet and then some shapes in the tip of the toes, so which will do offloading. And the other thing, wear thick socks, which will provide padding here. So even though you touch the ground, it will provide some padding, not that much rubbing or friction. And then apply lotion on the tip of the toe. So I said that do not apply lotion on your nails or in between your toes. But if you have hammer toes and if you see that your toe is touching the ground, apply little bit of lotion on the tip of the toe. So it won't be that much rubbing. It will minimize the rubbing. And then if it is creating too thick and hard time giving you walking, file it using a foot file So that you cannot do it by yourself. You need to go see a foot care nurse or a foot doctor to make it rub, and then they do filing, and if it is hemorrhagic callus or if there is blood underneath, it need a debridement. So that part you need to go see a foot care nurse or a foot doctor. Otherwise, daily basis, apply lotion, wear good shoes with orthotics, and then wear thick socks.
What if the top of the knuckle? What if the top of the knuckle gets red
Yes, that
because
is
of the hammer toe getting bigger?
Yeah. Because when you have toes like this, so this tip will touch the shoe, and its frequent rubbing create red color here, and then it cause corns too, and that is painful too. It can create ulcers too. So the best thing is buy bigger toe box shoes. So even though you rub like wearing shoes, it will not touch the top part of the shoe. And bigger toe box, more space for your toes. And then again wear thick socks, that will prevent too much rubbing. Again apply little bit of lotion on the tip of these knuckles so it won't rub too much.
I have a question about two things. One is massage, like using massage tools. The other is Dr. O, circulation promoter. What are your comments about those?
They are okay to use. It's best option if you cannot do much exercise, because it will improve circulation to your feet. Any movement which will increase circulation to your feet, that will minimize neuropathy changes too, and then give you overall well-being. So anything which will increase the muscle movement, increase the blood supply, is better to use. It's okay to use. Yeah, that's a good option. Yeah.
So like walking, that would increase the flow, right?
That's what we discussed. Yeah.
Okay, now you said hammer toes. Did your doctor tell you? Because nobody has ever told me I have hammer toes, so I don't think I have hammer toes. He told you. Okay, so then I don't have them, so I don't have them. You gotta be told what you have.
Yeah, I got hammer toe.
My massage therapist, and just from a regular appointment, and as I mentioned earlier, I had injured my foot a couple of times for a very brief moment when I didn't have any shoes or slippers on my feet, and he said, "Well, I'll spend a few minutes and I'll rub at it and increase the circulation." And later that day, I couldn't walk. I could not walk. So now I also have spinal stenosis, as well as diabetes and neuropathy and a couple other things. So I don't know if it was the spinal stenosis that maybe he shouldn't have been massaging my foot. All I know is I literally could not walk for the rest of the day. I was fine by the next day. So there was something in the, I get what you're saying about improving circulation, but for me, it turned out to be a bad thing, and I don't know why. But I just know that I'll never get him to do it again. He's a great massage therapist, but I guess I better not have him touch my feet because there's too many things going on, I guess.
Yeah, it depends on everyone's situation. There are certain kind of situations we should not do exercise, especially when you have a sprain or sometimes plantar fasciitis or any other injury in your foot. You should immobilize your feet, like give a rest to your feet. So we call it pressure offloading plus immobilize your feet. So your feet and the muscle need some rest. So if you do exercise or any muscle movements during that period of time, it will increase the problem. So if you have a sprain or any other injury, just go according to your medical advice, your doctor's advice. Try not to do exercise by your own thinking, like if you doing exercise on regular basis, but if you have a wound on your feet, you should do pressure offloading. You should not walk. Give some time to it to heal, and then if it is a sprain, you need to immobilize your feet, like that. So there are certain kind of situation you should not exercise. And as we talk about the machine, even for the machine, I would say use, when you have neuropathy, use a machine which you can see. I know there are some machines you put your foot inside the machine and then let it work. So it will do some muscle movements. But when you have neuropathy, always make sure you buy a machine which you can see your feet. You put your feet on the machine and you can still see your feet, because you don't feel your feet, so at least you need to see your feet. Okay, so always, I know Dr. Who's machine is a good recommendation. Yeah, anything which increase the muscle movement. Even the good massage, like if you apply lotion and massage your feet every day, that will increase circulation to your feet.
We don't want to know about
Yeah, she has a question.
If your legs get hard and they hurt like every inch of the way, and also they get warbly, is that inflammation? What causes it? What is it?
Sorry, I didn't get you.
I said if your legs hurt every inch of the way, like wherever you touch them, and they get hard, and also get warbly, like bumpy, like is that an inflammation or what is it? What do you do?
Yeah, foot pain comes with so many other reasons. Sometimes even peripheral vascular disease, sometimes diabetes and neuropathy also cause pain, and even arthritis cause pain. So those kind of,
When it's all bumpy like gravel,
yeah,
what does that mean?
it depends on other medical conditions as well. Sometimes if you have lots of swelling, that is
Lots of
also
what?
swelling.
Oh, swelling.
Yeah.
I do.
Yeah.
So why?
It's because of the circulation, and lots of fluid accumulate in your feet. Yeah, you will have big foot with swelling. So one thing you can do is elevate your feet. So it will help. Even when you are sleeping, try to put a pillow under your ankles. So it helps. And every time when you are lying down or sitting, put your feet up, use a recliner. And with the pain, if it is arthritis or sometimes neuropathy, yeah. So
Sciatica and bursitis.
yeah, then you need to take pain medication.
Yeah,
But even the massage with a little bit of lotion will give you some comfort. I would say like 100% cure, but will give you some comfort.
I use the Voltaren that they cross the neck.
Yes, yeah, yeah,
Okay, thank you.
yeah.
Are you familiar with a local company called Orpax?
No.
Dr. Brianne Everett, she has created an insole that goes to a smartwatch to let you know if there's pressure points on your foot.
Oh yeah, yes. Yeah, I have heard about it, and even at I think UFC they have some research going on about it. So yeah, it will track whether you have some pressure points on your feet, and then identify if you are high risk to create a wound in future. So this is to prevent wounds in future. So if they find out there are some pressure points, they can create custom made shoes or orthotics to prevent that pressure points. So that's a good option to prevent ulcers in your feet.
Yeah, I think maybe it's time to bring her back. It's been several years.
Okay. Yeah.
What can you tell me about swelling in the feet, like on the top of your foot?
Yeah. Swelling can come up with many other general conditions like kidney problems sometimes and circulation issues. So if your kidney is not peeing out enough water, like all the water, whatever you need to pee out, sometimes it accumulate on your feet as well. And then if there is any other circulation issue, whatever the blood supply coming to your feet not going back properly, then it will accumulate, make you have swelly feet like edema. So that depend on your underlying medical condition. So what you can do on daily basis is to put your feet up, and it will help, but there is no 100% cure from that. Yeah, take medical advice for the underlying cause, or the kidney problem or circulation issue. You need to pee out that excessive water. Yeah.
It's happened 3 or 4 times, but I've only had it on my right foot, not on my left foot.
It depends on your circulation again. If you are stand for long, if you stay up for longer hours, sometimes you feel your feet is getting little bit swelling. But you can do a scan to check whether your like the blood supply to your feet. There is ultrasound scans. You can talk to your family doctor about it, to do ultrasound scan on your feet, because if one foot is swelling and the other one is not, so could be a circulation from certain kind of arteries on your feet. So you can do ultrasound scan on your feet and find out what is the underlying cause. Okay.
Ultrasound for that situation. So talk to your doctor and get an requisition for vascular ultrasound. So the doctor will give that requisition, and then you can have it, and then they will check the blood flow of the both legs, and if there is any kind of changes, they will take necessary precautions for that. Actually, I had that issue.
Yeah, he had that issue.
I had that issue, so that's what I know about very well on that. So I met my family doctor, and then I went to one of these neurologists, and then he recommended me, and then they have checked my blood flow of the both legs. If there is anything, so they will start the treatments as well. Yeah. To be honest, once they have done the investigation, they said there is not a big difference, the blood flow of my both legs. So what they recommend for me, go with the physio. Yeah. Thank you.
Okay, so if you like to know more about your foot care, or how you look after your feet, you can go to Wound Canada website, and they have good resources to let you know how to look after your feet and some foot problems as well. Wound Canada website. Yeah. WOUND Wound, and yes, and then Canada. Okay, and then sorry. Or no, just you go Wound Canada, Google Wound Canada. So when you come to home page, you will see like a foot care, so many other options as well, but you will see foot care. Yeah. Compression stockings, yes, it's a good option for swelling as well, but always go with your family doctor. Buy compression stockings with the prescription. Do not buy over the counter, because it is good for the circulation issues and swellings, but not for everyone. It depends on your, as I said, swelling, it has underlying condition, so you need to go with your family doctor, whether sometimes it will work well, sometimes it will make the problem worse. So get a prescription from your doctor if you are going to buy compression stockings, and go according to that. And if you want to know more about your foot care, there is another website, that is Diabetes Canada. Diabetes Canada also have some resources about how you look after your feet. And then Diabetes Foot Care Clinical Pathway in Alberta Healthcare Services, Diabetes Foot Care Clinical Pathway. They also have very good resources about having healthy feet. Okay, so that is my short presentation.
Any other questions?
Yes.
You have one.
So I can remember, is numbing of your foot a sign of diabetes?
Numbness on your feet. Yeah. Numbness is a sign of neuropathy. But neuropathy comes after diabetes. So it is called diabetes neuropathy. Yeah, if you have diabetes, it could be part of it. But there are so many other reasons for numbness. Sometimes it's a back injury will cause the numbness, or a certain kind of trauma to your foot, like any other nerve damage, can cause numbness. It's not only diabetes or diabetes neuropathy. Could be a back injury, could be another nerve damage due to a trauma. So you need to find out with investigations. Otherwise, we cannot just guess you have numbness. It's because of diabetes. No. Yeah, could be diabetes.
And to access this nurse, doctor, you go through your family doctor? Is that right? You need a referral to see this?
Yes, you definitely need to go with your family doctor.
Okay.
Yeah.
You mentioned that it's free?
You mean to see a foot care nurse?
Yeah.
If your doctor is member of that primary care network, like at Mosaic Primary Care Network where I work, we have a diabetic foot care program that is a free service for 3 foot care visits. So that is a free as long as your family doctor belongs to Mosaic Primary Care Network.
Okay.
Yeah. Otherwise, you can get it done with so many other foot care nurses who do private practice, and foot care nurses, foot clinics. They do provide foot care, but you have to pay for it. And as I told you before, government will reimburse $22 for you, depending on your income, if you are a senior.
Thank you.
Yeah, Alberta Seniors Benefit will cover it, but it depends on your income.
Well, so if you have the Alberta Senior, it's on how much they cover?
No, it depends on your income. Sometimes, even though you are under Alberta Seniors Benefit, still they don't cover the foot care. It depends. They will do assessment. You can call and find out whether you are qualified. Yeah.
When I finished my 3rd treatment with Mosaic Network here, you gave me a sheet of
Category.
foot care doctors that are low cost or no cost. Can we get somebody to upload that sheet or something to
Yes.
our website?
Yes, definitely. I can email it to you, like a list of podiatrists in Calgary, like foot doctors in Calgary, and then some of them will do free foot care if your family doctor do the referral for them. So with the doctor's referral, they will do free foot care. So I will email that list to you, and then there is another option like for foot care nurses as well. So I will send it as well. Yeah. Yeah.
Able to be
Sure, definitely. Yeah, I think you have it already. Yeah.
Do you have any business cards or something to hand out?
I don't do private practice,
Oh,
so
okay.
I only work at Mosaic Primary Care Network.
And
So
where is that?
it's northeast part of the Calgary. Northeast.
Yeah. By the bay? By Sunridge Mall? or-
Yeah, we do have 5 central clinics. So one is at in front of Peter Lohi Hospital, in front of Sunridge Mall, and then the other one is at Temple Crossing, and there is another one at West Winds, and there is another one at 17th Avenue. So we provide foot care on all those places, but you need a referral from your doctor. Yeah.
Thank you.
Oh yeah, no problem.
Okay. Sylvia mentioned at the beginning that having diabetes does not necessarily mean that you have neuropathy or vice versa. Can you explain the difference or just what neuropathy by itself is, excluding diabetes, what the symptoms are?
Yeah. So neuropathy is damage or dysfunction of one or more nerves in the body. So it can happen with any other injuries, like if you hurt your back. Am I right? If you hurt your back. Yes, there are so many other reasons for neuropathy. So any nerve damage which cause you neuropathy. So nerve damage can happen with back injury, with accidents, sometimes even after surgeries you can damage your nerves and cause neuropathy. Yes, hereditary too. Yeah, so many other reasons. But diabetes is only one reason. So with diabetes it decreases the blood flow to your feet, and then nerves doesn't get enough oxygen and nutrients, so nerves get damaged. So diabetes is only one case, but you have so many other reasons to have neuropathy, but the feeling is same. Once you have nerve damage, you feel burning, tingling, numbness, and then you don't feel your feet. So the feeling is same. Yes. Sorry, I didn't. Oh yeah. Uh-huh. Yes, yeah, we do. We have a high-risk food team, high-risk food care team at Pedicure Hospital. So if there is anything not under our practice, we only nurses provide food care. So if there is anything go beyond our practice, we will send you to the hospital, Pedicure Hospital. They have food doctors specialized in food care, and then vascular surgeons, orthopedic surgeons will look over. Yeah. Okay, so that's, you are very welcome, and thank you so much for having me here. And I hope this short presentation will help you to have healthy and happy feet. Thank you.